All right, so the first episode, AJ, you picked this one. You ready?
I picked, yeah. So this one is season 1, episode 1. I think this is their exact first day. So go ahead and play it.
Okay, Martin, Robinson, Bond, Hawkins, Bond.
Yeah, they look excited. Honestly, we were excited at first.
So if you see now how like it seems like that was an attending. I'm assuming. So he was gathering up all these residents, and they're like, my attendings didn't do that. We knew that we were with the specific doctor. What time we got to be there, instead of him coming to look for us or her.
Nazi? Me too.
You got the Nazi? So did I. At least we'll be tortured together.
Yeah, I don't think they're allowed to say that. But
Yeah. Did you have a nickname for your attendings?
Huh?
Did you have a nickname for your
But I don't want to say that. They're probably watching.
Yeah, exactly.
I love you, all my attendings. I love you guys.
Yes. We'll make a shout out to all our attendings later.
Now you think I'm gay. No, I'm not gay. It's just that,
I miss
you know,
him.
you were,
I'm so sad he's
you were
there.
very
Sorry.
unforgettable. O'Malley, Yang, Gray, Steven.
Yeah, these guys are. Yeah, well, he's really out. Oh God, just give it away for the whole people.
End of the hall.
So they're getting ready. They're in the locker room.
first day,
Is your
right?
locker
First day
room? Is your
residency?
locker room like this also?
I wish.
Yeah.
I thought the Nazi would be a Nazi.
Maybe it's professional jealousy. Maybe she's brilliant and they call her
I
Nazi
think you should
because
pause
they're
it
jealous.
here.
Maybe she's
I think you
nice.
should pause it
Let me
here.
guess, you're the model.
So when you get to your attending, typically in the beginning, is that what you kind of did? Did you already know about the patients? Did you get everything, all the charts ready?
You see how it brought back memories. It's nerve wracking.
Good or bad memories?
It's good because like, you know how like in the one of the episodes he said it's like a battle. You know, like I really felt nervous. First of all, you got all these new doctors.
Yeah.
These are the smartest people in the world in the same room as you. And am I ready? You know, like am I ready? I'm nervous because you're taking what you studied in books and you're transitioning into like you're an MD,
Real
you're
life.
a DO, you're a real doctor.
Yep.
And you're taking care of them. And you have a group of people that are all together. And, you know, some of them you get along with, some of them you don't.
Yeah.
It's nerve-wracking, though, on the first day.
It is. I bet. Yeah, I know. I did my residency in Puerto Rico, so the majority of my patients were Spanish speaking. So it was really tough for me initially because I didn't speak much Spanish.
I remember when AJ first got to Puerto Rico, he literally
it was
no
a couple
Spanish.
words. It was a
And I
couple
remember
words.
the first night you had to call your attending, give him a full case in Spanish.
Yeah, it was nuts. It was
But
terrifying.
hey, you speak fluent Spanish now.
It
That
helps. It definitely helps. Absolutely, man.
Right, we're going to continue. Let's see.
Hi, I'm Isabel Stevens, but everyone calls me Izzy.
She don't care.
I have 5 rules. Memorize them. Rule number 1, don't bother sucking up. I already hate you. That's not going to change.
They already
From
hate
protocol,
you.
phone
They do
list,
hate us.
pagers. Nurses will page you. You answer every page at a run. A run. That's rule number 2. Your first shift starts now and lasts 48
God, that
hours.
pager.
They're
Ugh.
interns,
Used to have
grunts,
cell phone.
nobodies,
When you
bottom
use
of the
pagers.
surgical food chain.
Hour
Run
one.
labs, write orders, work every second.
See how they
like
walk in
you
order?
drop and don't
That's how we
complain.
usually
Run
work,
call
honestly, on every
rooms.
floor. The attending would walk and we'd literally just walk. It's
When you
kind of like
can,
an
where
army,
you
just
can, which
in a
brings me to
straight
rule
line.
number 3. If I'm sleeping, don't wake me unless your
part was
patient is actually dying. Rule number 4, the dying patient better not be dead when I get there. Not only will you have killed someone, you would have woke me for no good reason. We clear?
That's, first of all, pager. You didn't have a pager, right?
No, I used a cell phone. They
We
used
had
cell
pagers.
phones.
We had pagers.
Yeah.
And I would feel all my insomnia, I would say, seriously, it's a true story. My insomnia started from the pager.
Yeah.
Because like when you're like on call and you're in the call room and you're sitting there in that first page, you're so worried of not waking up.
Yeah.
The patient's coding or whatever it is,
Yep.
it really traumatizes you. Like I feel like people have PTSD from that pager.
Yeah. Well, luckily, our room, our intern room was on the floor that the medical floor. So if the nurse calls and we don't answer, she literally comes
to you, yeah, nah.
and knocks on her wake your ass up.
No, for us, they keep paging,
Yeah.
paging. And then once you get paged, like she said, if you're going to call me, the patient better be dying.
Yeah.
And if the patient's dead and you call me, I'm going to be pissed too. So like
Literally.
you're in a bad position. You're like, wait, I feel like I can manage the patient, but am I really ready to manage? So you make that phone call and you're really just freaking out, like trying to present that case.
So scary. So scary.
And also like talk to the nurses on the floor.
Yeah.
Because like when you know the case, the nurse knows how much insulin he got, how much IV fluids, what medications were given.
Yep.
When you're close, this is my recommendations for every intern. Be friends with every nurse on the floor.
100%.
Okay? They are the lifesavers. They will
Yes.
save your life.
100%.
So don't be cocky. Don't go in there thinking you're better than the nurses because you're an intern. You don't know nothing.
And you're not.
That
The
charge
nurses will
nurse that's
teach
been
you.
there 25 years
Yeah,
has saved a
exactly.
lot of lives.
Yeah.
So be friends with the nurses, number 1. Number 2, again, don't ask too many questions unless you're asked. And when you're ready to present the case, make sure you know everything about the patient.
For sure, for sure. I honestly believe a lot of my medicine was taught by a lot of the nurses because we spend the most time with them.
Yeah.
All the attendings are out at home relaxing, and we're with the nurses, 24/7. So
And they'll guide you. They're like, watch out from this doctor.
Yeah, exactly.
Talk to this doctor this way. And
Yes.
they kind of give you the cheat code.
Yep,
Like,
yep.
this is what you're supposed to do. Look
Yep.
out for that neurosurgeon.
Exactly.
He's scary.
He's scary. Or
don't call him at this time.
Yep. Or he's cool. Oh no, you need to wait till 2 o'clock. If you
Yeah.
don't call him after 2 o'clock.
100%.
It's pointless.
And
Yep.
some of them will make your life easy because they'll tell you like, hey, this patient has pancreatitis
Yep.
and severe pain. I see no orders for pain medication. I'm going to call you at
Yeah.
1 a.m., 2 a.m., 3
For
a.m.
sure.
I'm going to call you.
Yeah.
So let's be prepared ahead. Put a PRN order.
Yep.
It saves your life.
Yeah, absolutely, absolutely. So that's what I love. So that's the intern room there. I usually never had sheets. I'd have to go find sheets or ask a nurse to see if they have any extra sheets and change it. And of course, food was always a problem for us. It's 3, 4 o'clock in the morning, lack of sleep, no
Yeah.
food. You're just
Just
exhausted.
go to the cafeteria and eat whatever you can. But most of the time, the surgeons are in there and they're angry.
Yeah, they're pissed off.
And you don't want to see them because they're going to ask you questions. So you want
Exactly.
to avoid them as much as possible.
The on-call surgeon, he's just sitting there,
Yeah.
just pissed off. Like, what do you want?
You know, a lot of people ask though the call room. They always talk about like, you know how on the show everybody's sleeping with everybody.
Yeah.
And in the call room.
Well,
I feel like
kinda,
it really.
they kind of do that.
You think so?
Yeah, I mean, our hospital's kind of like
Yeah.
that. I mean, everybody
The
just did
attendings
crazy
are sleeping
stuff.
with the residents.
I mean, I don't think it's the attendings.
that
I just
bad?
think
Yeah.
I just think it could be just nurses and nurses. It could be
Yeah.
assistants or,
I didn't
or
see it as
residents or
much, but
interns.
yeah.
Yeah. I mean, it happens. It's not.
Yeah.
It's we're not we're not idiots, but it does happen.
We're not idiots.
We
you
know
ready?
it happens.
You ready to watch the next one? What's the next one? The lunch?
Yeah, I think they were talking about a certain procedure and.
The shift is a marathon, not a sprint. Eat.
I can't.
You should eat something.
You try eating after performing 17 rectal exams. The Nazi hates me.
The Nazi's a resident. I have attendings hating me.
You know Meredith is inbred?
Like it's uncommon around here to be a doctor's parent.
No, royally inbred. Her mother is Alice Gray.
Shut up, the Alice Gray.
Yeah. Who's Alice Gray?
Alice. The Gray method? Where'd you go to med school? Mexico?
She was one of the first big chick surgeons, and she practically invented the abdominal.
She's a living
retractor.
legend. You know, she won the Harper Avery twice.
So I didn't know one thing.
Talk about parental pressure.
God, I would kill to have Alice Gray as a mother. I'd kill to be Alice Gray. All I need is one good case.
Petty Bryce is a pain in the ass. If I hadn't taken the Hippocratic Oath, I'd Kevorkian her with my bare hands.
How are your kids doing?
What?
First of all, she said she did a whole bunch of rectal exams. We don't do rectal exams anymore.
No,
so
yeah,
times
we
have
don't.
changed.
Yeah.
We used to, and I feel like that was one thing that men hated is going in there.
I'm getting a rectal.
Getting a rectal
Yeah,
exam.
you were an
There-
expert at it. I'm sure you did a few. I used to do a lot of them.
I used to hate
Yeah,
doing
I know,
rectals.
they're horrible.
I feel like it was a punishment to the resident, right?
It is.
Like when you hated that intern and you're a third year or you're a chief resident, you're like, hey, bro, you've been bad. There's a
Yeah.
rectal exam in room 1. You come back. Obviously, he hasn't cleaned very well.
Yeah.
You go in, you get some chocolate out, and it's not really fun.
It's the disimpaction too, right? A lot of them are constipated who haven't had a bowel movement in a week. ICU nurse says, yes, the attending said that you're going to come and disimpact the patient.
Yeah,
Yeah, great.
I'm
Thank
good.
you for that.
No, I'm good.
But I still have to do it because the attending.
Nowadays, we don't do it, but I had a patient that's older. Came in. He hasn't seen a doctor in 20 years, right? So I went to go grab a glove. I grabbed the glove, and the dude's fully naked.
Oh, God.
Like pants fully off, and he says, do your rectal. And he's bent over, and I'm like, we don't do rectal, sir. Put your pants
Yeah.
up. I said, do a rectal. I'm already bent. And I'm like, sir, we don't do any rectals. Why do you keep asking?
That's horrible.
He said, I said, do a rectal. We got into a fight. He really wanted a rectal. I don't know why. I'm not questioning why, but he just wanted a rectal. So I ended up not doing it. He didn't like me very much after that.
Yeah. Well, there's a lot of patients that are probably just old school and
Yeah,
used
he's
to
just
getting all
used
these
to getting
rectals.
it. Yeah, I don't know
Yeah,
why.
so residency, honestly, for me, I feel like even like with the, they call her the Nazi, but she was a resident and he was worried about the attendings hating him. I mean, I feel like I'm very close with a lot of the residents, but I became extremely close with a lot of my attendings too. So we became good friends, and I actually wanted to stay in Puerto Rico afterwards, but the opportunity knocked, and I ended
we're
up
here,
in Florida.
and we're doing DocTok now, so-
Exactly. But
That was fun. If you guys like the reaction episodes, we'll do more of
There you
them. I love it. A lot of people love Grey's Anatomy. If there's other shows you guys want us to react to and you want to get a doctor's opinion of what the show is, if it's
Yep.
real or it's not, let us know.
Yeah, I think it's a great idea. And I think a lot of people who love these shows, and this is for real doctors and then, actors, of course, we can kind of compare and show what the real life doctors really do compared to a lot of these shows. But, Grey's Anatomy is probably one of my favorite.
The best show.
favorite
And every
ones, so.
residency is different. So
Yeah.
just because we didn't experience it doesn't mean that
Exactly.
you didn't experience it. And if you have, let us know. We'd
Yeah, I
love to
mean, you
talk
got
about it.
community programs and hospitals versus like university hospitals, right? So
100%.
they're
They're two different
completely
things,
different things.
100%.
So and
That
then you
was
have
awesome.
different options. So I love this. This was great. We could do a lot of this soon. And shout out to all of our attendings. Do
Yes.
you want to make any shout outs to anybody that you?
All my co-residents, all the attendings, go
Yeah.
LSU, go Tigers. Love you guys. I wouldn't be the doctor I am without you guys. So thank you.
Same here. And shout out to Manatee Medical Center, Dr. Bielka Centron, Dr. Araceli Nieves, Ignacio Acevedo, Dr. Rolon, everybody else, all my friends, all the residents.
You want to say something in Spanish for them?
Dios le bendiga.
I love it.
Kind of God bless you.
I like it. That's good, man.
You can learn some Spanish every once in a while.
No habla mucho, pero me entiende más o menos.
Más o menos. So see the problem here right there, you just kind of added that little.
See, this is why I don't speak Spanish. Because people like you like to make fun of me when I speak Spanish.
What's más o menos?
Más o menos.
Okay, but that's a lot better. Thank you. I can understand what you're saying.
Okay, but I chopped it up a little Puerto Rican. You know, Puerto Ricans, you don't remember they chop it up. Hey, cajo, ¿dónde está mi cajo? They chop it up. I'm trying to be cool here, bro.
Chop it up.
That's why I don't speak Spanish, because of this guy.
Hey, I hate you so much.
Anyways, love you guys. Please subscribe to our channel.
Yes,
guys, if you haven't subscribed to YouTube, please show us some love. Go on YouTube, subscribe, Facebook, Instagram, but mainly YouTube. We really need you guys to subscribe, okay? Love you guys.
Peace. Thank you.